So hello everyone, we're here today to talk about the COVID-19 vaccination program and to provide you with some important information. This is information that's reliable, it comes from Queensland Health, and it's the most up-to-date information that's available from the 20th of July 2021. The idea is that you can have this information so that you can make up your own mind about vaccines. So I'm Dr. Margaret Kay and I'm a GP who works in Brisbane, and I'm a senior lecturer with the University of Queensland. This is video 2, and it's about whether or not vaccines are safe. So the COVID-19 vaccination is safe for us. There's been a lot of research that's taken place across different countries, across people of different nationalities and different cultural vaccines. And this means that vaccines have been tested on many, many different people, and we have a lot of information about the vaccines to know that they are safe. There has been no testing phase that has been skipped along the process. It's been done quickly compared to other vaccines because there has been a lot of funding for the research, a lot of development that has been shared. Many different scientists across the globe have shared their information to enable other scientists to build on that information to develop these vaccines for COVID-19 sooner than we would have developed them otherwise. So we've been very lucky to have that collaboration in place. So are the COVID-19 vaccines in Australia safe? Well, yes, they are, because every vaccine batch is made to Australia's strict import requirements before it's even allowed into the country. And we actually manufacture a lot of the AstraZeneca vaccine here in Australia now. The TGA, or Therapeutic Goods Administration, actually assesses the quality of every single vaccine batch before it's actually supplied to us. So that way we know that it's actually safe for us. Now, a lot of people hear about TGA and OTIG. The TGA is the Therapeutic Goods Administration. They monitor, they evaluate the safety and the efficacy of vaccines. They make sure that these vaccines can perform well. They make sure that the only vaccines we will have in Australia are ones that will provide the immune response that we need. And OTIG is the Australian Technical Advisory Group on Immunisation. It's a team of experts, predominantly doctors, who actually provide an enormous amount of information so that we actually know that we can use these vaccines safely. They provide advice on which vaccines can be used in which populations and how they can be delivered. So we have a lot of information from both TGA and OTIG to ensure that Australians receive safe vaccinations. Now, will the COVID-19 vaccine change our DNA? There's been a lot of rumours and myths out there around the safety of vaccines. And the answer is that COVID-19 vaccine cannot change our DNA. It's not designed to change our DNA. Do COVID-19 vaccines contain alcohol and animal products? No. COVID-19 vaccines do not contain these products, so they are safe to use for people who are concerned about those particular ingredients. Is the COVID-19 vaccine safe for breastfeeding mothers? Well, of course, we want our children to be safe. And yes, you can receive the COVID-19 vaccine if you are breastfeeding. You do not need to stop breastfeeding before or after getting the first or second dose. And in fact, if the mother is protected, the child will be protected because we are less likely to transmit the virus if we are vaccinated. So it's a great way of protecting our family. Is the COVID-19 vaccine safe when we're pregnant while we're carrying the baby inside? The answer is yes. So there's been a lot of research in this area. And if you are pregnant, you can receive the Pfizer COVID-19 vaccine at any stage of the pregnancy. It's a good idea to talk to your GP, your obstetrician, your midwife about these questions to make sure you're confident about having the vaccines. And if you're thinking of getting pregnant, can you still have children if you get the COVID-19 vaccine? Yes, you can. And it's a great idea to get vaccinated before you get pregnant so that you actually have that vaccine on board so that right from the beginning of your pregnancy, you're protected against COVID-19. You still have to protect yourself with all the social distancing and everything else, but it's really important that you protect yourself against COVID-19 with vaccination. So can I get COVID-19 vaccine if I have a serious allergy? A lot of people are worried about whether or not they might have an allergy that prevents them from getting COVID-19 vaccination. The COVID-19 vaccine is a unique vaccine. So if you've never had that vaccine before, you won't know if you're allergic to it or not. If you're the sort of person who has many allergies, it's very important you talk to your doctor about having the vaccination and how to do that safely. And it's very important that you don't let the concern around allergies stop you from being vaccinated. You need to talk to your health professional. If you have a medical history of any serious illness, including serious allergies, take that information with you to your vaccination appointment. Take the information around your medications, whatever health conditions you have, whatever allergies you have, and any vaccines that you may have had in the last 14 days, and have a list of all that information provided to the health professional who's providing you with the vaccination. And tell them if you've had reactions to other vaccines. If, on the other hand, you've had a very serious reaction to COVID-19, then that's a different thing. So some people have already been vaccinated with COVID-19, and it's very, very rare to have a reaction to COVID-19 vaccine that's a serious allergy. But if you do develop a serious allergy to COVID-19 vaccination, you'll need to talk to your health professional about what should be done if you need a second vaccine. So you must not get the vaccine if you have experienced anaphylaxis to a previous dose of COVID-19 or to one of the ingredients within that vaccine. But if you have had a serious anaphylaxis related to COVID-19 vaccine, that's the sort of thing you need to talk to your doctor about. If you're receiving regular treatments for certain conditions, you may also need to talk to your doctor about that, particularly if it's complex routines with medications. And your doctor will be able to provide the information that you need. If you're unsure, ask your doctor.